This is a red, inflamed gum area of a patient who's 25 years old with lots of tartar underneath the gums. And you can see the discoloration of the gum tissue. And as we place air on the tooth, you'll see the gum tissue move, and you'll also see the tartar drying out, and there's actually more there than what you initially saw. And that's because the drying out of the tooth a little bit helps to see the tartar. The gum tissue there is very, very irritated, and this 25-year-old hadn't been to the dentist in quite some time. And over time, he would lose bone because he's younger. He's had a fortunate situation where he hasn't experienced any bone loss. But having that type of chronic inflammation occurring where the food is trapped between your teeth day after day causes bad breath and contributes to heart problems as he'll get older. And there's been research to state that it also is the chronic inflammation of that type of bacteria is crossing the blood-brain barrier and contributing to dementia and possibly Alzheimer's. Here you can see where the tartar has, in the back area, has stuck to the teeth, and it's a very fine layer. And when it's this consistency, no amount of brushing is going to get this out. You have to go to a hygienist or dentist and have them professionally clean your teeth. This is something that will probably take multiple visits, and he has tartar caught underneath the gum tissue. And in order to see it on the x-ray, which in this case he has, there's quite a lot there. Sometimes people will need to be numbed up for that, even though they haven't any bone loss. Now, when there's this type of plaque and bacteria occurring in the mouth, it's not unusual to develop decay. And there's little spots that may be cavities, and then there's some that are for sure. That was a tooth that was a peg lateral that a composite was put on. Little chipping of the edges of his teeth. There, the tartar is completely around the teeth on the wisdom tooth, and you can see the decay that's developed. There's the video of that. The rest of this is the x-rays.